Welcome, everyone. Happy to have you here. Welcome to Perfecting PT. Today on the podcast, I've got Dr. Mike Pomykala out of the East Coast, and he specializes in treating golfers. So I'll kind of turn the time over to Mike to just kind of introduce himself, and we'll just kind of have a conversation. Today's episode is probably going to run about 35 minutes. If you haven't already seen that when you clicked to listen to it. But big things I'm hoping to kind of get into with Mike in the time we have is talking about kind of his views on the body, particularly with golf and how the body breaks down, what he commonly sees that he needs to address to get people back to being able to play a lot. Because I think if anyone works in any type of outpatient ortho clinic that has any sort of decent weather, you often get people that are coming in that are dealing with some type of injury related that is stopping them from playing golf. So Mike, welcome, dude. Take all the time you want to introduce yourself. And then we'll just chat.
Yeah, cool. Well, thank you for having me. Again, my name is Dr. Mike Pomykala, from New Jersey. Physical therapist. Have a couple board specializations in orthopedics and sports. TPI certified, so that's the Titleist Performance Institute. Level 3 track in medicine. Also have my level 2s in power, fitness. There's one more in golf itself. Strength and conditioning certification. I can ramble on, but that stuff doesn't mean nothing if you're not helping anybody. So thank you for having me. Appreciate it.
Oh, absolutely, dude. I'm pumped. I mean, I'm going to have to get a whole new comment section to be able to put all your credentials into the show notes.
You're good. Don't worry about it.
So anything else you'd like to say about yourself, Mike?
I'm a golfer myself. I wish I had a better handicap. I'm probably like a 9 right now. But okay. Honestly, like you said, you don't even need special good weather nowadays. There's golf dens, golf caves, all these places nowadays popping up, especially in New Jersey. People are practicing all year now indoors in a simulator, which is a good thing and a bad thing, which we can get into. But yeah, so people are playing golf like no matter where all year round now.
No, sure. I actually had a patient recently. He's like, what you should do with one of your treatment rooms? He's like, you should put in a golf simulator. And he's like, that would make you so much money. Yeah. And I'm like, I'm sure it would after we paid off the $25,000 it cost us to put into the building.
Yeah. Yeah. And so I'm sort of in the process right now of trying to create my own golf lab. I have a mobile one. So I use pressure plates. So you can see, how the golfer's loading, what part of their foot they're loading. It gives awesome data because that's really where the golf swing starts, from the ground up. So it gives great feedback. And then I have 4D, so it's 3D motion sensing. It's by a company called 4D. We place sensors on the body, and it gives you different ranges of motion. It gives you the golf sequence, how each body part accelerates and decelerates. It can give you swing speeds. It's an awesome tool. But I'm in the process of sort of taking those sort of things and making a lab sort of more on steroids to have then the TrackMan and all the other things where we can take all these numbers and because with the TPI testing too, we look at your physical capabilities. So that's where I come in. What can your body do? What can it do? What's it good at? What's it not good at? And how does that directly reflect into your swing? It's just one of the pieces, in addition to the other ones are mechanics. You actually know how to hold it, what the grips are, how you should swing. Then the other is the equipment itself. Are you fitted for your clubs? Is it, you stole your dad's clubs? They're too long for you. They're too heavy for you. So, a lot of people don't realize how much actually goes into perfecting your golf swing. And it's never really perfect, but those are sort of like the 3 things. And so being a PT, I look at the body itself. I have golf professionals who I'll refer to and say, hey, this is what I'm seeing. Can you maybe help them with these mechanics? And then there's a few different places that fit people around here. There's a Titleist fitting place around here. So it's great. I can just send them down and say, hey, we need to, maybe take a stiffer shaft or a less stiff shaft because this is what I'm noticing with the speed. So
Fascinating. I mean, I feel like everything I thought I knew about golf just suddenly disappeared.
yeah,
Um,
yeah, there you go.
well, I've got to be honest. I was telling my boss. My boss is a big golfer, and I was bugging him. I was like, Phil,
Okay.
I'm gonna talk to a golf guy tonight. You got any questions? You want me to ask him? And he was like, nah. He was, you know, he's had a thing, and so he hasn't
Yeah.
really had much time to,
Yeah. There you go.
he couldn't harass me in the normal way that we joke around. But I kind of joked
Sure.
with him because I have an old set of Callaway clubs, some old Big Berthas that I got.
Mhm.
I picked up the whole set, all the irons, putter, 3 woods, and driver. I picked up the whole set at a yard sale in Vegas for $50. And I think I've had the same
I
pair
mean,
of
you can't
clubs
beat
since
it.
I was, I don't know, probably 15. I've had these clubs for like 15 years. And you know that toxic
Technology has
trait
come a
when you
long way.
watch stuff on social media and you're
Yeah.
like, I could do that.
Mhm.
I could do that.
Yep.
Like, I think every
Yep.
man, and I'm sure some women have it as well, but I think every man watches some dude
Sure.
do something online that guy spent so much time learning to do. And he's like, I could do that. Like, for sure.
Easily.
And
Yeah.
I've always had this toxic belief that within 1 to 2 years I could be a professional golfer and I could be a scratch golfer. And so I was
we all
telling that
do.
to my boss, and he's like, "No, you couldn't." I'm like, "Oh, I think I could." He's like, "No, you couldn't, Nate. The game's too hard." And I was sitting there, I'm like, "No, yeah, I definitely." And I was just sticking, just poking him. And the fact that
Yeah.
you're talking about club weight and club length and fitted and so many things, and I'm like, maybe it's a little more difficult than just putting the ball in the
And
hole, because that's pretty much how my mind works.
yeah, and Nate, think about it, man. We didn't even talk about the courses itself yet. What type of grass is it? You know,
Yeah.
is you'll hear guys like Phil Mickelson say like, "Well, I know if I use this wedge in the morning where there's more dew, it's going to go 105 yards, but in the afternoon when it's warmer and it's going to go, 115 yards." And they have it down to an exact science. And you look at guys like they just did one with Scotty Scheffler, right? Number 1 in the world. And
Sure.
they put him on a TrackMan and he hits it and they're like, all right, 9 iron. What do you like? How far? What's the distance you think that went? And he's like, that felt like 158. And he's maybe off by a yard or hits it on the nose every time he swings his club. I mean, that is like,
it's unbelievable.
It's a skill, but it's you're born with that, and then you just again perfect that. It's nuts. So while I agree, if I had all this time to spend on golf, I could be, scratch golfer. At the same time, like there's just so many different dynamics that really go into the game itself. And then the head game, the head game is probably one of the biggest ones. God,
absolutely.
what am I doing? Am I not like a lot of times you're in your own mind and you just can't break out of it. So I like to say,
Yeah.
as a PT, you like to say we're always psychotherapists in a way too, talking our patients through things. So, and golf is no different.
Sure. So I know we don't have a ton of time, and I had sent you an email earlier. So I'm very curious on your views of the body. Like I know mine.
Sure.
And I find that very few people actually know their views. A lot of people think, but most of them don't understand how or why they think. And I'm very curious about your general views of the body and how it relates to why people break down in golf. Because I'll be honest, the whole biopsychosocial thing, I'm sure it affects how people compete and any number of factors. But I just think as a whole, it's often used by people to excuse why they aren't more proficient in things that they should be as a physical therapist. And if you disagree with me, that's cool. Like, I'm not trying to be disrespectful towards anyone, but I would like to understand why you think the body breaks down in general, and then kind of specifically how that relates to what you see with golfers.
Yeah. So love that question. And I'm going to kind of grab different things in different areas here. So,
please do. Please do. Answer however you'd like.
Yeah. The first thing I try and decide. And so when I say I mean we, me and my patient, because I'm
Sure.
trying to, I'm lucky enough where I can work one-on-one with my patient. That's kind of the model that I've had. So we typically have, especially for golfers, like an hour and a half to 2 hours to really break things down. So is this an injury that you've experienced prior and you're bringing to the golf course, or is
Mhm.
this happening because of the golf course?
Got it.
Is your swing injury inducing, if that makes sense? So we try and break that down first. Is this like I had a rotator cuff surgery, in my 40s, and now I'm in my 50s and my shoulder's bothering me again? So,
Mhm.
and it could be a little bit of both, you know what I mean? But it's like, I never had pain before. I'm a 26-year-old, person. I've been playing golf for 3 months now, and now my wrist hurts. Well,
Yeah.
that could be injury-inducing mechanics, like that you brought now that you're doing through the golf course. So
Right.
that's what I like to, are you bringing it to, or is it because of? I don't know if you know the SFMA, FMS World Functional Movement Systems.
I do.
So they are, yeah. So a lot of the foundations of the TPI stuff is through functional movement systems. They kind of go hand in hand together. So I see the body as a set of mobile parts and stable parts, essentially, in a
Yeah.
in a broad term, that is run by the nervous system, right? That's in my opinion the thing that trumps all, right? Reading books about pain and motor patterns, motor programs, those sort of things that will help influence how mobile or stable the body is. You have
Right.
the other factors that are non-modifiable, right? Just your genetics in general, like that we can't, right? So more like, in healthcare, more people are prone to developing arthritis. They can do everything in their power and they develop arthritis anywhere. And then you get people who drink, smoke, do this, and they like are scot-free and they just get through life with no pain. And so
Right.
I believe genetics have a big component of how your body tolerates different stresses. Socioeconomic stuff. What's your diet like? What type of food can you afford? What type of food do you want to eat? Do you sleep? Are you looking at a phone all day? Are you sitting at a computer all day? All those things that we kind of factor in to different stresses on the body. But to go back to what we were saying, I view the body basically as the brain and the nervous system as the generator. So that's the software, that's the computer, and then you have your hardware, which is your tissue type, your tendons, your joints, your muscles, those sort of things. So they both feed off each other. So then that's where your sort of diagnostic skills come in. That's where your intuition comes in. That's where your reading the literature comes in. And you take all those together and you kind of input what you think, why the body's breaking down or what's happening. Use your interventions to try and address it. Does it stick? Does it not stick? And then you kind of go from there.
And for people who are not, so I'll kind of ask a few questions about that. For people who are
Sure, go ahead.
unfamiliar with the stable and mobile model,
Yeah.
can you kind of delineate, and you can start anywhere you like, and I'll ask questions as we go along.
Sure.
What are the areas,
Yeah.
if you kind of go through the body segmentally,
Sure.
so meaning like ankle, so let's just start with the ankle. Ankle, mobile or stable?
Mobile.
Ankles are mobile. Knees?
Yep. Stable. That's
Stable.
not to say, most people will say, well, the knee moves up and down traditionally, right, but the knee doesn't have as much freedom as, say, an ankle, or then we get to the hip, which will be more mobile.
Got it.
That's not to say that the hip's not stable. You know what I mean? It's just a device where it's just a model where they say like, and then you get into the lumbar spine, which should relatively be stable, which the thoracic spine and the rib cage should be more mobile.
Okay.
And then you get to the cervical spine, which is going to be more stable. Okay. And then you get to the upper cervical spine, which is going to be more mobile. Shoulders mobile, wrists mobile, elbows more stable.
Okay.
That makes sense.
And no, right. And for anyone listening, to Mike's point, it's not that the things like elbows and knees and backs are not mobile. It's that the general role that they have within the system of the body to work are generally more stable in that they have a more limited degree of movement than others.
Correct.
So
And
now
you
I'm
look at
curious,
some
Mike. I know I'm
research,
kind of going
right?
a little off script.
No, go ahead.
Oh, sorry. Yeah, keep going.
No, I was gonna say, and you look at research, right? And you like distal mobility requires proximal stability, right? So you think like, you tell someone to flex their quad, which muscle flexes first, and most of the time it's gonna be like TA or something within the trunk to
Yeah.
stabilize your body to allow that to happen. So that's again going back to mobile and stable. That's why like the core is traditionally thought of as more of a stable segment.
No, correct. No,
Yeah.
we are 100% on the same page.
Yeah, cool.
So I'm curious because I know, and I know how I feel about this, but I'll keep my mouth shut temporarily.
No, go ahead.
I know that there's this big push where they're like, the lumbar spine is meant to be stable.
Mhm.
I mean, is meant to be mobile. Load that shiz. And I'm like,
Yeah.
don't think about
Yeah.
that. Well, like, how do you feel
Yeah.
about some of these things that are going on now that people are kind of throwing
Yeah.
that out, where they're like, the knees
Yeah.
should be super deep into these squats and the back you should be doing Jefferson curls. Like, how do you interpret those views?
I love that question because this was a big thing in the golf world for such a long time, right?
Yeah, and what do you mean by
Coaches would
that?
do.
I don't know the golf world.
So I'm going to explain it right now, okay?
Right.
So coach would have a side-by-side. They say, all right, Nate, we're going to film your swing. They watch you swing. Okay. This is Tiger Woods right next to you, right? See what he's doing? That's what you should be doing. All right, well, I can't rotate like he does. Doesn't matter. That's how the best in the world swings. That's how we want you to swing. Well, he's the best in the world because he's able to do that. That's part of it. Not everybody's bodies are the same. Not everybody's bodies are capable of the same. Hip angles, right? Different femur lengths. All those things go into how certain people should train, right? And I say it all the time, like, again, with diets, like this diet works. No, this diet. Well, what diet works best for your body and your genetics? Because we all come from a long lineage of people that only ate certain foods for a long time or only drank certain foods for a long time. So going back to your question, like if you can load a spine that's, in a certain position and it makes you better at what you do, then yeah. And again, there's always inherent risk in everything, right? So like, would I tell a power lifter to maybe start his, lift with a flex lumbar spine? Probably not. And we just know like length tension mechanics, power mechanics, like the power should come from the floor up, and you can load it into a flex spine, but you're not really going to get that power transfer and drive like you might want it to. So again, it's that age old adage, it depends, but like, I know some people who can easily knees over toes just fine. Mm-hmm. Some can't, like some hips are, the pelvis is much more narrow. So they might be easier to squat with more of a narrow stance, and you tell them to go wide and they can't, or vice versa. It just depends what your body allows you to do and what you can train it into doing.
Oh, sure. 100%. No, I agree.
Yeah.
And my problem is not with the response. It depends.
Yeah.
I am perfectly content with it depends. But for the people out there that use it depends as a catch-all for the fact that you don't have an answer, that bothers me.
Yeah.
Like,
and
just because to your point,
we've all seen
it depends on that.
Yeah.
Like
I couldn't agree more.
You. Like, no, I agree 100%. Like, we are not in disagreement.
Yeah.
Like, it depends. Oh. I turned on the lights, and for whatever reason, they're still on motion sensors. But that's one thing. It depends on something. And I think that there's a lot to be, there's lacking theories and models that help us determine what shaped people are going to be better at this, and how do you determine if a joint will be better at that. And so people say it depends and it's like, I understand that it depends. So I'm very appreciative that you talk about, like, there are certain people, like Tiger Woods has a body that is probably perfectly designed with an interest that he took very early on. It's like his genetics
Correct.
and his body proportions very much aligned with his desire to play golf. And you cannot be Tiger Woods unless, to a certain extent, you have similar genetics and a build and a drive to enhance those things. So that being said, I'm sure, because again, I know we're kind of short on time tonight, but we can always get you back. That's always the good thing. If
we can probably go a little longer than anticipated, so don't worry about it. We can probably.
Oh no, dude, you're good. It's late for anyone wondering right now. It's 7:15 Mountain Time. It's 9:15 for Mike out in Jersey. So he's taken a good chunk out of his day and evening. You married, Mike?
With 3 kids, 3 boys.
Yeah, dude, we got to get you home. Those bedtime stories are more important than my podcast.
Listen, they're sleeping now, so this is my quiet time. Actually, I could just zone for a second.
Well, so that being said, Mike, like I know we could probably, I'll ask you this question, and then I got golfer questions, obviously.
Yeah.
Is there a system of are there systems that you rely on to determine what someone's ability is going to be with golf? Like for example, I know that there are groups that talk about like infrasternal angles and how that relates to other likely joint shapes and capacities that will make someone inherently better at these movements versus wide infrasternal angle people. And for those listening, it's called like an ISA model. Is there a model that you look to say, hey, this guy in front of me, maybe his body's just going to break down playing golf because he just doesn't have a lot of the characteristics that are necessary to play golf? Like, does my question make sense?
That's a great question. I would say a few different things. One, we look at, again, this generalizes to sports nowadays, that like, you played golf and you worked on golf because that's what you needed to do. It's a very difficult game. There's many aspects: driving, irons, chipping, putting. But nowadays we see all the best golfers in the world, right? Your Scotties, your Brooks, your Dustin Johnsons, all played multiple sports. So that cross training, like learning how to sprint, accelerate, like, that's how you can develop a lot of those explosive muscles. I don't know if people always understand how explosive a golf swing is, because on TV it looks like very, but just like the speeds that are smooth, but the speeds and the amount of force that those golfers are creating puts them at a high level for breaking down. Just in general, right? That because there's all different you get lateral forces, then you get horizontal forces, then you get vertical forces. So if those are not timed or sequenced properly, then your average person who's maybe not taking care of their body as much, they work 9 to 5 and they play on the weekend, they're going to be a little bit more prone to injury because their body's not used to those stresses, or the stresses aren't distributed in an appropriate manner. And when I say that, meaning like, your pelvis into your trunk, into your arm, into your wrist, that's sort of how the ground force should come up. When those get out of whack, the body starts to break down. So those people who played multiple sports, because they then tend to maybe be able to generate more explosive power in general. And then those who grew up with the foundation of mechanics for golfing. So like, meaning like you can bring me the like fittest person in the world that just doesn't understand the mechanics of a golf swing, and they can, so just by having a great body doesn't mean you'll be a great golfer, right? How many times have you seen people on tour, John Daly being one of them, right? I don't know if you're familiar with John Daly.
I'm not.
Sort of okay, so look him up, right? Guy's kind of overweight. All he does is smoke cigarettes, drinks Diet Coke. I mean, and the mobility and the power this guy has. He's a major champion,
Oh,
and you'd be like,
fascinating.
like that guy should be playing lineman somewhere. You know what I mean? And
Right.
you like he's like Chris Farley, dancing and moving. Like that guy shouldn't be able to move like that. So
Hmm.
uh kind of going back to that, like just knowing, but he's great just at creating that force from the ground. So again, what I see is those who played multiple sports as growing up, that know how to generate power in different planes, and those who just understand the how to drive the force from the ground into their hand, that typically become better golfers.
And it seems like kind of how I'm understanding that is you're saying that people who play multiple sports, it almost seems like a coordination issue. Like people who play multiple sports learn to
100%.
control their
Yep.
body. Like their proprioceptive
Right.
system is just so much more in tune with their body's ability to use that in a way that lets them generate more force because their body is so comfortable
Totally.
moving in different directions and knowing what it's
Yep.
doing.
Yep. Yep. 100%.
So,
Like again, the maybe the football player who played linebacker his whole life, right? Linebacker, you're kind of thinking north and south most of the time. You're running, you're not really
right.
doing a lot of horizontal movement, right? You're kind of this way. But but that same player who also played basketball and had to move this way and then play baseball. So that type of person probably has a little bit more capacity to coordinate a little better because they're used to it. Their proprioceptive input is just that much more mature than someone who's done one thing their whole life. And now I'm 25 and I just graduated. I'm a CPA and I got to go out and golf with, but like for work, they have
Right.
a tougher time understanding it because they're taking it up so much later, that their nervous system is that much more mature than that age where we can learn things so much faster.
Right. So I'm assuming one of the big things you get in the patients you see is back pain.
That's a big one. I would
Um,
say back
yeah. What are
pain
the
is a big
others?
one. Back pain, knee pain is a big one.
The front
Uh,
or the back knee?
oh, it's usually that's a great question because it depends on the golfer's
Right.
compensation. So right, so
Got it.
if someone's like hanging back a lot like this, you're probably going to get back knee. If you're
Okay.
someone that sways more, you're probably going to get front knee. So it just
Got it.
depends on how they compensate.
Okay. So
And
back and
that's
knee.
again right. And then shoulder and wrist
Hmm.
a lot. You'll
Both
see.
sides as well,
You'll
depending
see
on how
like
they compensate.
yeah. Uh, for the right-handed golfer, you'll typically see the lead arm, so left wrist and elbow. It does
Okay.
it does more of the work than the backhand does.
Okay.
And then shoulder, again, it just depends. Usually, again, the shoulders people bring from home to the golf course,
Hmm.
and you'll see all sorts of things like chicken wing, where they'll come through and they don't fold over. They kind of do one of these things. Um, that's a big one for those like especially for the lead shoulder, those who have like rotators, so left rotator cuff repairs. Uh,
Right.
Again, doing that like almost crossover arm. If that posterior capsule gets a little tight, they can't do this, so they might compensate by doing more excessive side bending or
Mhm.
rotation. Again, getting from the hip, they might sway. You know how the brain compensates. It'll do path of least resistance. So that's where like again, just doing the eye test, it's hard to say like, well, could be this, could be that. It depends. When I have my thing, it's okay, these are the tests that we're doing physically. Can you do this? Let's get you on the pressure plates. All right, this is where your body's going. This is the timing of your pressure from your back foot and your front foot. This is what the speeds that your chest, your pelvis, your arms, your wrists are decelerating. Is it the correct order? Is it the correct sequence? Really, in the golf swing, you've seen, like, I don't know if you watch much golf, but more or less, yeah. So nowadays, like it again used to be you have to have this perfect backswing and then perfect downswing. But now you see like people on the backswing do all these like funky things. Like you might see like guys like hands come up this way. Jim
Mm-hmm.
Furyk was a big one where he kind of like he did like one of these things. But we've noticed all the best players in the world sequence their downswing in the same manner. So no matter
Hmm.
kind of not no matter what they do, but they all like those who do funky things end up in the same position and then they sequence the downswing the same. So
Oh,
that's the
interesting.
most important thing that yeah, for golfers. There's like one thing where if your pelvis is going faster than the club in the backswing, that can really throw disorganization into the downswing. But for the most part, you'll see like all these funky swings. But as long as you get to that sweet spot where then you can properly use your ground reaction force to sequence in the right manner, then you're good.
Okay.
That was a tangent. I'm sorry.
No, that was not a tangent. That was excellent information. So, for
Yeah.
anyone listening who may have got lost there, it seems like the big things that Mike sees, which is going to just sound like the whole body,
Yeah.
is going to be back, knees, and it could be either knee, depending on how they compensate, shoulders, and it sounds like shoulders are often it's brought to the golf course, not caused by it.
Mm-hmm.
And then the
For
elbows and
for the
wrist.
most part.
Yeah, for the most part, of course, we got to speak in like there's never absolutes. And then
Right.
elbow and
Yeah.
wrist injuries are often on the lead arm, meaning the front arm.
Yeah.
So if you're right-handed golfer, it's going to be your left arm, and if you're left-handed golfer, it's going to be your right arm. And it seems like the big thing that really needs to be adjusted as far as mechanics and coaching go is the sequencing of your downswing. Because if you kind of get off there, you
Correct.
may compensate in other ways. Is that correct?
100%.
Okay,
Yeah.
great. So what do you often find? I know that oftentimes once we've kind of chatted about the sport, about
Mm-hmm.
your specialty, we get into the evaluation process. There isn't really much time for that right now, which is okay,
Mm-hmm.
which is perfectly okay,
Yeah.
because I'm really enjoying all the like I've already got multiple bullet points of notes that I'm getting down. I would really like um, if we could chat a little bit about what do you see people lack? Because obviously I'm assuming like you're going through the SFMA, you're looking at these
Yeah.
people's bodies, like you said, like from
Mm-hmm.
the TPI standpoint, it's like as a
Yeah.
system, and
Right.
how is that system going to either improve their ability to play golf or limit their
Mm-hmm.
ability to play golf?
Yeah.
And so I'm curious, what do you see as the common limitations of
Mm-hmm.
people that you're assessing? And you're welcome to take that however you like. You could say, like, I
Yeah.
have this weird belief with the lower body that most people's compensations and limitations are the same, but what breaks down in their body and what they end up having pain is different based on any number of factors. And I don't like it. Would you say that it's the same with your golfers, that they have the same limitations, but that leads to a different outcome as far as what is injured or limiting them?
100%. Because, like you said, everybody's brains are gonna choose a different way of compensating. If, or again, like one of I think the biggest lack of understanding that not only golfers have, but people in general, is how athletic the golf swing really is. And
Hmm.
so people say, hey, I'll take up golf. I'll go play on the weekend. It's easy. But, like the average golfer, minus putting and maybe some shorter chips are going to swing easily, like 70, 80 times. Right. And if you're not used to coordinating or knowing how you should properly sequence that, like it's athletic. Like it's very similar to, like throwing a baseball or swinging a
Mm-hmm.
tennis racket. Like, people see that, and because it's more dynamic or you're running, but it's almost harder to like hit something that's still than it is to react to something sometimes. You know what I mean?
No,
Um,
100%.
so I feel like, yeah, I feel like one of biggest thing people lack. Like when we do our, especially like some of our power testing, like the best players in the world, their non-dominant side is a certain percentage of their dominant side. And like,
Oh,
and they've
interesting.
done
And
research where
what is that ratio?
I want to say it's they put it in a calculator. I want to say it's like got to be within like 85% or something like that. So like if my right side power output is 100 pounds of whatever, they want left to be like 85 or close to something like that. Again, don't
Oh,
don't put those exact numbers on it, but
sure.
again, it shows how not only like how athletic they are, but two, there's like this the name escapes me right now, but this theory where by having that power almost exactly the same as the non-dominant side, it reinforces how well you are on your dominant side, if that makes sense.
Okay. Yeah.
So
Yeah.
so I'll do these tests with my patients, and their right side will be 100 pounds of power and their left is like 30, and they don't
Ugh.
realize that disparity makes a huge impact just with their overall like athleticism. And so I might say like one of the tests is take a medicine ball, you're on like a line, and then you're going to rotate and throw, right? And we measure the distance and we see how far you can get. We'll get some patients that throw their medicine ball 25 feet, 30 feet, boom, green light, that's great. Left side barely gets like 15 feet, you know what I mean?
Yeah.
And it's like it shows that. And again, I don't know the exact theory or why, but the best players in the world are just as good at almost doing it bilaterally, and that's something to say for how well it translates to the golf swing.
Okay. So I've always thought that that symmetry matters. It
Yeah.
seems that in this circumstance,
Yeah.
that idea is reinforced.
100%. Yeah.
So one of the big functional limitations is that there is an asymmetrical power output
Yeah.
when they have to, again, use their dominant versus non-dominant side. And to your point, that's probably, especially if they come from a background of not playing multiple sports, they've never learned to move all directions.
Right. And going back to the golf swing in particular, right? So if I'm a right-handed golfer and I get into my lateral shift, say, my right leg produces, like 150 pounds of force through 125 pounds of force. The left leg, the lead leg, has to generate almost 150 to 170 times more power than the right, because not only do you have to decelerate the right side, then you have to reaccelerate to get your hips out of the way to allow the club to come through. So think about like if I'm doing a power test with my right side and it's sufficient, it's where the best players in the world are, and then I'm doing it on my left side and it's not nearly half of what the right is, I need it to be almost 1.5 of what the right is. Well, now I'm developing back pain because my left leg can't, my left hip can't clear my pelvis. So what am I doing? I'm maybe like reverse spine angling and or hanging back, and everything is just compressing back here.
Oh, no, that makes 100% sense to me.
Yeah.
So for anyone who didn't catch that, if the right leg, so for those of you who may not be as familiar with golf, but who may be familiar with baseball, a right-handed player is someone who brings the club behind them on their right side and swings through to their left side. And what Mike is saying is that if you are the front leg, so meaning the left leg that you are swinging towards, it has to be strong enough to decelerate all the force being produced by the right leg initially. Gosh dang it, you stupid light.
Yeah.
Glad to have that quality commentary. I was on a roll. So if the left leg does not have adequate strength to decelerate the load that is being generated by the right leg in order to maintain a stability required to create precision with the club, and then get the hip out of the way. So it has to decelerate to maintain stability, then accelerate out of the way to allow things to go through smoothly. If the leg cannot withstand that force, the body will compensate by leaning back onto the right leg to kind of offload the amount of force going onto the front leg. But in response, the spine flexing to the back side will create compression and added load on the right side.
Yeah.
Would
And
you
that
say that's
just
correct,
could be
Mike? I
one
don't
of
want to
the
misrepresent that.
Yeah. No, that's good. And that, again, that could just be one of the compensatory factors. So one is that right leg. Another one is that right leg will generate force this way. This doesn't clear ahead of time. So, all right, maybe instead of, hanging back, I just let my body slide through. And now that left knee, that front knee is getting more strained. And now with all that force, then at the end, I have to try and save it and twist and rotate. So now you're getting meniscal issues in the lead leg because so much force is being created into that front leg in a position we don't want it to.
Right. So,
Yeah.
I mean, obviously, anyone listening here, if you don't know who Happy Gilmore is, educate yourselves. Watch Happy Gilmore. But this just really is bringing to my mind when Chubbs is grabs Happy and he's like, it's all in the hips. It's all
That's
in the
right.
hips.
It really,
would
honestly,
seem
it really is.
Right. It seems that the back and the knee are then victims of what the hip is unwilling to let the leg manage during a golf swing.
And that's for a lot of golfers, their pelvis rotation and hip rotation is key. And again, you might get that person who's 55 is dealing with a labral tear. You're not going to fix it, but you might give them modifications or strategies. So like, that front leg that's got to internally rotate as I'm coming through, essentially. That's a bad thing to do for hip impingement or labral tears. So maybe we start that front leg a little bit more externally rotated and flare it out a little bit. So as I load it, I have a little bit more space and time to get where I need to get that club down before my hip starts to pinch or feel pain. And again, that's just one modification. Maybe, I might have to stagger my stance a little bit. Like the one thing about the golf swing is there's no perfect golf swing, but there's one perfect golf swing for you, essentially. So that's why I like the days of like Nate, Tiger, that's what you should look like. Well, my body physically can't do what Rory McIlroy is doing. My body physically can't do what Dustin Johnson's thoracic turn is like insane. And my body's not getting there. Like, it's just not. So those are things that you have to know and recognize and respect about your body. But that's not to say we can't do things to maybe, we started with, let's say, like, and I'm talking about gross movement. So let's say like in the backswing, we want to be 90 degrees, right? Like shoulders down parallel, even though the thoracic spine doesn't turn 90 degrees. But if I measure here, that's going to be 90 degrees from, the plane we're looking in.
Right.
Maybe when we first started, you were at 70. And I'm like, you know what, though? I feel like you can get there. So we mobilize, or maybe we retrain, we do a little PNF patterning. And now you're at 90. Well, I want you to be at 90 now, because now you can create even more power in your golf swing. And everyone's always looking for yards and, but just like anything, all right, this is 90. This is new to you. So we have to learn new proprioception. This is 90. Don't lose, don't lose your posture. Don't do this. Don't sway. So there's things where you have to modify around. And then there's things where you're like, no, like we can make some good gains here. Like, let's use that, because now your thoracic rotation speed went from 500 degrees per second to 700, and we want it closer to 700. So those are the sort of things you have to talk about with the patient, and how much time do you have to practice? Like,
right.
Yeah.
So for anyone who didn't get to see the visual, and who also may not be familiar with golf, we're gonna chat about this, and then we're gonna wrap it up. We're gonna call it a day. We've already went over. But for those who weren't watching, Mike was demonstrating a swing where if you rotate, meaning you're going to swing the club comes behind you to the right, And if your torso, meaning like does not rotate sufficiently to where your left shoulder as you rotate to the right is not pointing in front of you, so perpendicular to your feet, like there's a thoracic limitation. And at that point, you have to decide, does this person, are they ever going to get that rotation? Because if so, that's something you should look at. If not, you're going to have to maybe address other factors. And I think this really plays into what you're saying, Mike, about the mobile and stable portions.
Yep.
It would seem that the hips need to be very mobile and very strong.
Yep.
And the thoracic spine would also need to be very mobile, very well controlled. So, and strong, because otherwise, guys, this is what I'm understanding from this. If you don't have adequate hip and thoracic spine mobility, your low back, your shoulders, and your knees will be the victims of the compensations that you will choose, because ultimately, if your body's trying to get a certain motion and it can't come from where it is supposed to, and I know someone's going to scream at me, it can come from anywhere. Well, hypothetically, let's say it shouldn't. If it can't come from where it should come, which would be a quote unquote the stability. That okay? I'm not speaking falsities.
No, yeah, and then another big one is the ankle. And again, when we're thinking about ground reaction forces, you need sufficient mobility in the foot and the ankle to be able to adapt, create, and use from the ground up. If you're not getting enough mobility there, because again, for a right-handed golfer, right, as I get into my backswing, what does that look like right there, right? It's almost like a hinge, right? And what do you know about people who can't dorsiflex and try and hinge, that they're going to create compensatory patterns, right? Same thing like with the lead leg, right? As you go through and you have to plantar flex essentially and jump vertically. If you don't have that plantar flexion, you're not going to get as much ground reaction force as you need. So ankles are big too.
Wow. Well, I have so many questions, but that's okay. That's okay.
Listen, I would love to come back and discuss it another time. It's like, especially in the golf world, it's never ending. Like there's constant data coming out, this, that, it's so dynamic. There's so many things about it, which is why I feel like people fall in love with it, because it's that thing, that itch that you can never, you're so close, but can never reach. Like you're always so close, but you hit that one perfect shot and you're like, I figured it out. And then the next hole, you're like, what just happened?
Oh, yes, 100%. You want to hear me swear badly? Take me to play golf.
Yeah,
I will.
There you go.
My mouth is it's something. Also, Mike, I apologize if I've ever interrupted you. It's my computer is making you very quiet for some reason. So if you have interjected to tell me that I'm an idiot,
you're good.
I didn't hear that.
I'm lagging a little bit too. So like there's once in a while I'm catching like every third word you're saying. So I'm just like trying to piece it together. You're good.
So Mike, we're gonna wrap up now. And I'm gonna ask you the question that everyone always wants to know. What is either a course, book, or resource that you have found really like fundamentally influential on you as a PT? And since we're talking about golfing, especially like specifically in the golf world, would be awesome. And if you want to throw in anything else, that would be cool. And then feel free to wrap up, plugging yourself, where you work, how people can contact you, and anything you'd like, and we'll call it a day.
I think two of the most beneficial classes I've taken, multiple courses through the Institute of Physical Art, the IPA. They're very hands-on manual therapy based clinic out in Colorado Springs, but they have
heck yeah, that's where I'm at.
Oh, there you go. Oh man, we'll talk. We could talk about that offline a little bit, but amazing, just fundamentally sound manual therapy classes, PNF classes, just really do PT the right way. Another one is PRI. It's become very popular nowadays.
The Postural Restoration Institute.
Restoration. Yep. A lot of correctives that I have for some of my, not only golf, my patients, but my golf patients too. They're great. They can be taken online too. hands-on classes are always better, but if you want just the knowledge, they're great. And then the TPI courses, the SFMA stuff, which is really the foundation of where I use all my stuff. If you're in the golf world or want to get to, start there, and then build your knowledge from there. Yeah, I'm out in New Jersey, Monmouth County, Middletown, New Jersey, Central Jersey, which is, a joke we have in New Jersey. It was only north and south, and now we have a central, and I'm part of that. And it's kind of near the shore, so we have some great golf courses around here. My clinic's called Sports Solutions PT. You can find me on Instagram at that, or my personals is Michael Pomykala, and Pomykala1. So feel free to shoot me DMs if you have any questions. I do virtual stuff with people, so don't have to be in New Jersey. Just we can do some stuff online too. So it's cool stuff. Hey, listen, man, thank you for having me. This was great. Hopefully we'll get around to it.
My absolute pleasure.
Thank you. It's been fun.
You cut out there a little. What'd you say?
Yeah, I said no. Thank you. It's been fun. I love a round two whenever you'd like to have me.
Great. Well, we'll get that planned. And for the rest of you guys, you'll just have to stay tuned, and we'll see you when we see you. Thank you, guys.
Sounds good.